Welcome, old viewers and new viewers, to another episode of The Dancing Negotiator with Dr. Cheryl Okoli, DHA. This is the show where you learn all about conflict and its resolution strategies. The what, the when, the why, the where, the who. Evidence-based frameworks are introduced as it pertains to the topic at hand. I also like to introduce original mnemonics. For example, my original 5 days of conflict resolution mnemonics, or mnemonics of other authors who are either experts in conflict resolution or have something pertinent to share as it pertains to the episode at hand. I like to reserve the 3rd Fridays of each month to have story time. This time could entail a movie, drama, an event, and we analyze it to see what went wrong as it pertains to conflict and what could have been done better to address the conflict situation at hand. So as an example, next week is technically the 3rd Friday of this month, but just a heads up, we will not be meeting because it's Good Friday where I am, but story time will just be postponed to the upcoming week of this month. So I highly recommend that if you've not watched the various episodes and previous episodes where we were analyzing the workplace drama called Sticks and Stones Workplace Bowling Drama, please watch the previous episodes that illustrates our analysis for episodes 1 and 2. So the drama in itself has 3 episodes altogether. And in 2 weeks' time, we're going to be analyzing the 3rd and final episode of this drama. You can find it on YouTube, ITV, or BritBox, and each episode is about 4 to 6 minutes long. Just a heads up and a disclaimer for some of you who might have experienced workplace bullying, and depending on where you are in the healing trajectory, I do caution you that some scenes might elicit some poignant memories. So I highly recommend you watch it with someone, a family member, a colleague, or a friend, and bring them and join us in 2 weeks' time as we analyze the final episode. Now, the 4th Friday of each month on the show is saved or reserved for a guest. Now, this guest might be an expert in conflict resolution or has something salient to share. So come back for the last Friday of this month as well. And that guest also has value to share as it pertains to the theme of the month. So as an example, the theme of this month of April and next month in May is all about the business of healthcare. You might ask, what does she mean by the business of healthcare? What does she also mean when she describes herself as a doctor for your health administration needs? I recommend you watch the previous episodes if you have not, to let you understand what I mean by those. But for today and this month, we've been talking about the business of healthcare using the framework called the Quintuple Aim Goals. Quintuple means 5. So in the last episode, we talked about the first one, which is about improving the client's health or the experience of the client. And today we'll be talking about improving the health of populations. So now, I believe it's very important in whatever workplace setting that you find yourself, regardless of industry, that you use appropriate jargons if you are communicating with someone of a similar mindset, or it may not be a mindset, maybe similar discipline, because across disciplines, certain words and terminologies might mean something totally different. So it might be best to stay away from jargons altogether. And again, in this world where we find ourselves, people being global citizens, right? So people can be in the healthcare industry, but it varies from province to province at times, country to country, continent to continent. So avoid jargons if necessary, but if you must, make sure you explain what the term of terminology means. So as an example, improving the population's health. What does population mean? Let us just start by saying that I'm going to use a layman's terms definition and just say basically it's a group of individuals that have a shared characteristics. I am very holistic in nature. I practice holistically from a healthcare perspective, and also in my dealings with people from a conflict resolution standpoint. And what do I mean by holistic? Let us remember the human beings entails the physical, mental, social, cultural, and spiritual. So in the same token, an individual or a population seeking healthcare services of some sort may seek healthcare services pertaining to one or more of those domains of the human beings. So let's say, for example, if you're talking about the physical domain, it could be a group of individuals that share a common illness, morbidity. It could be maybe hypertension or cancer or obesity. So that could be an example of a physical aspect of a population. It could be from a cultural, so maybe this group of individuals, their shared characteristics is cultural, but specifically they have some ethnic backgrounds. And those ethnic background influences their healthcare practices. So it could be the indigenous populations, maybe people from South America, Latina population, Ukrainians, you name it, African, right? Well, even African is broad because there are different countries in Africa, for some of you who do not know this, and the cultures vary from east, north, south, and west, right? So again, being clear what your population characteristic is. Spiritually, it could be a group of people from the same shared faith organization as an example. Mentally, it could be maybe a group that have or live with depression or anxiety, okay? So now that you have an idea what I mean when I describe a population, I want to ask you some reflective questions, and these questions are for you to reflect on. And if you do have a paper and pen, which I highly recommend you bring coming while you join us each week, jot them down as I ask them. And I know some of you might need a longer time to reflect, but for the purposes of today's episode, just quickly jot down what comes to mind. So think of a population of choice. So a population that is seeking or receiving a healthcare service, regardless of domain, be it physical, social, cultural, mental, spiritual. Now that you've identified the population, what is being done well for this population? Is it sustainable? So these services you're receiving, is it sustainable? And by that, I mean, so yes, they've identified they need something, they're receiving those services, but are those services being received on a short-term basis or a long-term basis? How sustainable are they? And then what gaps in care do you see for this population that you have identified? And finally, last but not least, why, in your opinion, do you think that there is a gap? So once you've jotted down whatever comes to mind, the population of choice I would like to introduce is the seniors population. And you might ask, why am I choosing the senior population? Well, there are myriad of populations that I could choose, but for today, I just thought I want to focus on the senior population. But let us start first. What do I mean by senior population? Because I'm very cognizant of the fact that people viewing this and the replays don't all reside in Canada. I have an international audience. So when I say senior, I'm using the phrase used in Alberta, Canada, to be specific, because that's where I reside and practice. So a senior is usually defined as an individual 65 years and older. So the population we're focusing on is anyone 65 years of older seeking and requiring a healthcare service. Now, let me zoom in a little bit and focus on seniors in the continuing care umbrella. You're like, what does that mean? So usually when we think of healthcare services, most people think of the hospital. That's acute care setting. But did you know, you probably do know, that healthcare services can be delivered outside of the hospital. So that could be in terms of an outpatient basis, or you can actually receive healthcare services by qualified interdisciplinary staff, either in the home care setting, and by that I mean wherever a senior resides and they call their home, the healthcare services providers will come to their home to deliver that care. Yes, they can deliver physiotherapy there, occupational therapy, nursing services, you name it, social workers. So that's one setting under the umbrella of continuing care. Another sub-arm of the continuing arm in Alberta is assisted living or supportive living. Think of it as congregate care, where a group of individuals are under one roof receiving healthcare services and other services as well, like boarding and feeding and recreation as well. And then last but not least, there's a third sub-arm, which is long-term care setting. Okay, so which is basically they receive the biggest differentiation between the long-term care and assisted living is the staffing pool and the fact that usually there's a registered nurse 24/7 around the clock in the facility. Okay, so now, so population of choice, how do we improve the health of seniors living in one of those arms of the continuing arm umbrella? But for today, let's focus on the long-term care setting. Some people call it a nursing home, okay? So that question is a very difficult question. Why? Because improving the health of the senior in a long-term care setting means different things to different people, and there are different arms and sub-arms one needs to assess and analyze. So what does improving the health mean? So again, they're there for a reason. Usually they cannot live in their original home environment. Either they're unsafe to reside there, maybe they have some cognitive issues that makes them unsafe to reside alone in their homes, or maybe they need 24-hour nursing services, which we know cannot usually be provided in a home care setting. So they are moved into or welcomed, I like the expression welcomed, as opposed to admitted into a long-term care setting environment where they receive 24-hour care for their physical needs, for their social needs, mental needs, and spiritual needs, okay? So how do you improve the care of this senior in that environment? Well, I would like to say first and foremost, when it all begins originally, when the operators of that facility were creating and drafting the foundational needs of that facility. And by that, I mean in terms of what is the work staff, the workforce, what does it look like? The expertise, the number of people required. What are the educational resources for orientation for this group of people, for the healthcare workers? What is the budget to ensure that they have the human resources, the material resources, so in terms of like maybe the beds, and then when it comes to the feeding, they have adequate utensils, and not just any mere utensils, but appealing and aesthetically appealing utensils. The food that's provided, that is good quality food, not just tiny portions, but good wholesome meals that are of a balanced diet, for instance. What is the recreation? What are their socialization needs? You know, do they have outings? Do people come in, companion care? Spiritually, do they have on-site, maybe a pastor, or depending on the faith you belong to, do they come in or do they have access to go out? Do they go out on recreations? So all that needed to be sorted out at the beginning. Now, the reality is some organizations may not have had the luxury of having all of those domains well taken care of. But sadly, when the foundation is faulty, everything else that's built upon it, every pillar that's added, so to speak, becomes precarious when there's a shortage in any one of those domains. So let's say, for example, and I'm going to speak from my understanding of what happened in Alberta and another province. Specifically another province, I won't mention it, but especially in the last 2 years, it came to the media attention that certain care, there was neglect going on in some of the long-term care facilities, to the point that people were abandoned, neglected, and worst case scenario, they died. Now, what was the cause of this? Some of it could be like some of them were short-staffed, and with the pandemic, either the staff maybe were afraid to come to work, they quit, or they themselves were sick. There were multiple reasons why that situation happened. However, the reality is the pandemic just highlighted this issue. It was an underlying issue happening, but for some reason, it did not garner media attention. It might have to some extent, but nothing was really done. But with the pandemic and all this news, sadly bad news being broadcasted, it got the attention of the people higher up, if you will, and then action was really implemented. So here's a question. Why did it have to take a pandemic for action? And when I say action, not just at the micro level, but at a macro level. Micro, I mean, you could say at the individual facility site. Macro being more at the legislative, so basically laws or policies implemented at the provincial level or federal level. Why did it have to take that? That's a rhetorical question. I have my opinions. I'll reserve it for now. But what I would say, or like to say right now, is that shouldn't have happened. Because I know, having worked in that sector, no peers that work in that sector, I know people have had concerns for the longest time, but sometimes it's almost as if certain parties, depending on what position you find yourself in the hierarchy of reporting or role in your organization, you might feel like your hands are tied, or you're reporting either internally or externally, but nothing's being done. People get tired, people get hopeless after a while. But that's no justification, but it just provides an avenue of understanding as to why things might have fallen apart or were falling apart. Now, I want to introduce a model to you that helps us understand the different stages when an issue is identified, how it makes into policy, and then how it becomes law. This is a model, it's called Kingdon. I'm going to share my screen with you. And this policy, I'm going to explain it based on how I understand it. Some other people might explain differently, but this is the way I want to explain it for the purposes of today. So it's called the Kingdon's Policy of Opportunity. Some calls it the policy stream. There are different names and titles for it. So hopefully, I hope you can see my screen as I share that. And as I get my laser pointer, I will explain it the way I understand it. So some resources call it the Kingdon's Policy of Opportunity. Some calls it the Kingdon's Streams Model. Regardless of what you call it, basically the premise is this: there are three streams that need to be addressed in order for a policy to be implemented. And when I say implemented, usually at a high macro level that influences, be it on a provincial, state level, or national level, federal level, okay? So the first stream, so the streams are problem stream, policy, and politics. So problem stream refers to, let's say that a problem has been identified by, you can say, grassroots levels or by individuals, like individual people. So talking about the senior population. So maybe a problem was identified by either the individuals that are residents in the long-term facility, or maybe the family members, as an example. And then the policy stream has to do with like maybe individuals from organizations or reputable associations, advocacy groups. And then the politics stream has to do with agendas that are on the table, you could say, so to speak, for politics issues, political issues. Now, according to Kingdon, when all three align, so basically, let's say, given what happened with the pandemic and that issue being highlighted in media about the lack of care, poor quality of care being received in long-term care facilities, a problem stream, it was identified. Regulators and associations, I hope, identified it, and then it came to the political agenda. So that created a window of opportunity, and the timing was such that it was a good time for all parties to create that window of opportunity for policy changes to happen, okay? So now, I believe policy changes were made at individual facility levels. I am not sure at this point in time, I'm gonna stop sharing my screen. I'm not sure at this point in time what changes have been made at the legislative level. Now, again, remember, each province is different, governed by its own provincial legislature. and sometimes federal legislature trumps provincial legislature. But if the military had to come in and intervene in some cases, that shows you how that really got the attention of everyone, regardless of level of legislature. So my question again is, why did it have to take a pandemic for changes to happen? Now, putting things in perspective, like I said earlier, different parties, depending on what levels they are in an organization, have been mentioning to different parties, okay, we need help, things need to be changed, this policy is not adequate, but nothing happened. So for example, I know at one point in time, there was a legislature that said that for a long-term care facility, you need at least an RN there 24/7. Now, depending on the organization, whether they're for-profit, non-profit, or non-for-profit, however they're governed, some people, sadly, might find a loophole in that clause and ensure that as long as there's one RN, be it at the front lines or in an administrative level, they've met the requirements of that clause. But how dangerous is that in terms of risk management and in contingency planning? That's inadequate. That just means the bare minimum. What about that RN, regardless of role, they need their breaks, they need their vacations, they're gonna get burned out. Stay tuned. The care of the care provider and burnout will be subsequent episodes next month, okay? But yeah, so how does that help? It doesn't help, right? So again, going back, improving the population of seniors requires astute, intricate planning by individuals that are skilled, that have a forward-thinking mindset, a growth mindset. And when I say growth mindset, I don't mean in terms of scaling the business, but in terms of individual parties who realize they don't know it all. New innovations are being introduced. They have long-term mindset of learning, okay? So having said all that now, here's some call to actions for you. So far, before we talk about the call to actions, we talked about what it means by improving the population, the health of the population. You identify whichever population of choice, either one that you're passionate about, where you actually work or you volunteer for. How sustainable is the current services you're receiving? Why do you think it may not be sustainable? What are the gaps in care? We've talked a little bit about the Kingdon policy streams, be it, which comprises 3. The first is, well, you have problem statement or problem stream, you identify a problem, then you have the policy stream, and then you have the politics streams. If just one stream is trying to raise an issue, it's very hard, it's very unlikely it will be heard and implemented at a legislative level. Usually you need all 3 parties, 3 streams to coincide. I don't agree with that. I don't think we need to have that window of opportunity. But the reality is that's what's happening. But yes, I'm looking for people like-minded, wherever. Don't always wait for that window of opportunity. Prevention is better than cure. Make sure that when you're planning your organization, your business, your service, that your foundation is secure. So when the winds hit, the storms hit, be it fire, water, floods, whatever it is, you will not be found on faulty foundation, like on being built on a sand, so to speak. Not on a sand, but you know what I mean, a sand castle. But let it be a firm foundation for your business, your organization that supports the residents receiving care, the staff that provide the care, and also making sure you have that good contingency fund from a financial perspective. There are people who know how to use an allocated budget and stretch it. How do they stretch it? Stretch in the sense that, number one, you make sure you have qualified people in their appropriate position, be it from the front lines and in leadership, so that there's no turnover. Make sure that everything is balanced to mitigate turnovers, to mitigate buying poor equipment that will be replaced in maybe 2 or 3 years. Look for things that are durable, right? So these are all the things that need to be kept in mind. What about change management? In the example I gave, what was a change management for those organizations that found themselves whereby they had poor staff and residents were receiving inadequate care? You know, so keeping all that in mind now, so I'm gonna ask you, share some call to action steps for you. And the first question I'd like to ask you is, or call to action steps for you to reflect on and act on are the following. What advocacy efforts can you perform for the population that you work for, volunteer, or passionate about? Can you do it independently, or do you need to garner support? What is stopping you? Go and do something this month. Now, you might have identified some things and you're like, oh, I've always had it. I know what it is. I've spoken, it's falling on deaf ears. Well, it sounds to me that you're feeling stuck, even though you have a plan of action. Now, if you're feeling stuck and you have a plan of action and you want another set of eyes to review your plan, your proposal, I invite you to contact me at Cheryl@shalomeagleswings.care. And I can spend some time, quality time, reviewing it with you and providing appropriate recommendations. My website is www.shalomeagleswings.care. Care, why care? Because I do care for you, for your organization, for the health of populations. So you see, what we've talked about so far are different arms of the business of healthcare. So a bit of strategic management from a high level perspective to begin with, risk management, change management. And let's talk about the quality improvement part of this. How do we improve the population health? Yes, for whatever service it is, it's not just a matter of quality assurance. And by that, I mean, if you have yearly or every 3 years or every 5 years accreditation practices, it's not a matter of just making sure that you check off the box to meet accreditation qualifications or credentials or renewals. What about the concept of continuous quality improvement? And by that, ongoing assessment of the quality of care being delivered to your population. Ongoing, continuous. And the mindset of continuous quality improvement is a mindset and a practice that requires buy-in and implementation of all employees, regardless of hierarchy in the organization. It behooves senior leadership to be cognizant and aware of the quality improvement initiatives and practices for their organization, for them themselves to model it and exemplify it, so it's not just the task of those at the front lines. Yes, the individuals, employees at the front lines may be required to implement it, but it could be something that is included in each person's evaluation, maybe yearly appraisals, some aspect. How did you assist in continuous quality improvement? And not just senior leadership, but the boards that govern these organizations. At least I hope there's a board that governs these organizations. So as you see, again, quality improvement is an area that I can help you or your organization in my consultation services. So, dear viewers, I don't share this for you to be disheartened. People in healthcare have good hearts. Most go in for the right reasons. Sadly, things happen and people might get jaded and things start falling apart. That is no justification for any individual, any population not to receive appropriate or quality care. But the question is, we see what's happening, we see the gaps. I like to say that we need to detect gaps, plug them, and even better, prevent them from happening. So see you in 2 weeks' time for another episode of the Dancing Negotiator with Dr. Cheryl Okoli, DHA. But before we leave, I always like to leave you with this thought. Remember that you are needed in this world to be a solution. Be the best that you can, and do not rob the world of a precious gem. You. That's right. You are special. Goodbye and have a splendid day.